This is a short video to assist you with the interpretation of patient results. This one is geared towards progesterone and specifically towards women who are thought to still be cycling. So if you're cycling, we're looking at reference ranges in the luteal phase. So that's the phase right after ovulation when progesterone production should be at its peak. The way we plot our results, you can see the postmenopausal range, also pretty close to the range for a premenopausal woman who's not cycling or is in the wrong phase of the cycle, like the follicular phase of the cycle, which would be the first 10 days or so of the cycle. The premenopausal range should be up here between the stars on this sort of graph. So as you look at these particular premenopausal women, starting with this one on the lower left, what you can see is progesterone. We measure the two primary metabolites, the beta pathway and the alpha pathway, meaning beta and alpha pregnanediol. And what you can see for this particular patient is the beta metabolite is on the higher side of normal, the alpha metabolite is on the lower side of normal. So more of the progesterone is going down this pathway than this pathway. Which pathway is preferred is not really that significant in a woman who's not supplementing. What we're just trying to do is use this predictively to represent systemic progesterone levels. And the best way to do that with urine is to measure both of the metabolites, and then what we plot here is a weighted average of the two. So if you look at this other woman, you can see that the progesterone levels are pretty similar in these two patients. They just happen to have opposite metabolism. So the woman on the right pushes very little progesterone down the beta pathway and pushes a lot of progesterone down the alpha pathway. Most urine labs just measure this one metabolite. It's really better to measure them both the way that we're doing here. These are the two primary pathways. When you're looking at progesterone, these women, as they come right in the middle of this premenopausal reference range, are essentially exactly average. That's an average amount of production in the luteal phase for a premenopausal woman. If you want to look at women who are abnormal, you'll find these types of results. The woman here in the upper part here, upper left, that's way down in the postmenopausal range. So it is very unlikely that she's actually ovulating. Whereas in the upper right-hand corner, you'll find a woman who is just barely into the premenopausal range. So it's most likely that she is ovulating, yet is not producing as much progesterone as you would expect to see following ovulation. So two kind of different stories there, but both on the lower side. And then, of course, you can be normal. And then we've got this woman here who one of her metabolites is actually out of range because the woman happens to push her progesterone more down this alpha pathway. The beta pathway is still within range. And when you look here, you can see that it's essentially high normal. So good, strong progesterone production. And then when you look in the lower right here, you can see a woman who's quite a bit higher than the average woman for progesterone. So there's someone who makes a lot of progesterone, and also where you might want to rule out supplementation, not just of progesterone, but also pregnenolone. Pregnenolone supplementation increases progesterone metabolites in urine, and so you'll definitely want to check on that if your results are high. But by looking at both metabolites and an average of the two, we get a good idea of where their progesterone production is relative to what's expected. Now, if we're trying to ask questions about potential estrogen dominance, then the way that we want to look at this is instead of looking at a single ratio between two metabolites, say beta pregnanediol and estradiol, we really want to take more of a general look and just ask the question, which one of these is predominating? In this case, it's fairly obvious that the progesterone is within range, but it's fairly low within the range. Again, remember the middle here would be exactly average for a premenopausal woman, whereas the estrogens, some of them are high, some of them are high normal, but as an overall score, if you will, for estrogen, it's coming out a bit higher within the range than progesterone, meaning if one of these hormones is quote unquote dominant, in this type of case, it's the estradiol. So that when we're looking for estrogen dominance with this type of a test with so many metabolites, that's the way that you want to kind of approach that, is just to see which hormone is higher within the range relative to the other hormones. So I hope that's helpful. And if you have other questions or other scenarios, do see the other videos in this series that can help you navigate those and make sense of the progesterone picture for your particular scenario.